everyone. Thank you for joining us. My name is Dr. Regine Mathieu, board certified dermatologist and current cosmetic fellow here at Behr Laser and Skincare Center. Thank you for joining us and welcome to our Elacor event. Elacor is the device, our microcoring device that removes several tiny pieces of skin, and we will have a live presentation and a demo where I'll be treating Dr. Behr. Be sure to stick around towards the end where we'll have a live Q&A session and you can submit all of your questions, which we are very excited to answer about this device and all things Elacor. So I wanted to take a few minutes to go over our specials and our giveaway for attending this event. So in terms of our specials, if you buy 2 treatments of the microcoring, you will receive 20 units of Botox, as well as the Calm Post-Procedure Kit, which is an exosome therapy that helps with the redness and just overall skin rejuvenation. And if you buy 3 treatments, then you get 50 units of Botox, as well as the Calm Post-Procedure Kit. And our giveaway is $1,000 gift card, which is super exciting, and you can use it on a variety of services. And in order to be entered into the raffle, you have to reply yes to the text that you'll receive after attending the entire event. So we're really excited about this new technology that Ellacor utilizes to remove a specific percentage of surface area of the skin, which essentially allows shrinkage and to alleviate laxity and wrinkling on the lower face and the perioral region. And just a brief description, but definitely stick around because it'll make a lot more sense while you're watching the video. But essentially we're taking tiny cylinders of skin, almost like a cookie cutter, to remove tiny pieces of skin at sizes that won't cause scarring in the skin. And so essentially that removes 8% or 5% of the skin, which is compounded by different treatments. So we recommend about 2 to 3 treatments depending on the severity of your laxity. And in order to make sure that we are safe, we do recommend multiple treatments so that we can maximize how much skin we're removing. But essentially this technology, there's no heat, it's all physical, and the device actually sucks your skin off and essentially helps with wrinkling and tightening, and it's just a very nice procedure to add to our repertoire here. So one of the main reasons why we're so excited about this technology is because it's really unlike anything else. Other devices that we use, including like micro needling and CO2, I think that a lot of patients tend to ask how this device compares to those treatments, because the ultimate goal is always rejuvenation, skin tightening, anti-aging. And it's different because it's physically removing the skin. CO2 is different because it's more so on the surface, but this is going to the depth of the entire skin surface essentially to remove the pores out. So it's very, very different. So the Ellacor device mainly treats skin laxity. It helps with smile lines, it helps with jowling, because sometimes jowling can be due to fat, but a lot of times it is due to increased laxity, so removing that skin will help to tighten that area. It helps with perioral wrinkles. It can also lift the lip by removing skin in that area, and the distance between under our nose and our upper lip tends to increase with age, and we're always trying to find ways to decrease it. So this is an excellent, non-invasive way to lift the lip as well. Patients who are excellent candidates of this procedure include patients with any types of laxity. I think that the increase in skin lines kind of on this cheek area is a huge concern, and this treatment has done phenomenally at removing those concerns, and then the perioral wrinkles as well, reducing that. So the first 3 days after the microcoring procedure are the most intense in terms of how you will look. Typically after the procedure, we recommend nothing but gentle cleansers and either Aquaphor or petroleum jelly to keep the skin hydrated. And so the day after, typically patients state that they're a little bit oozy. Sometimes there is a little bit of tenderness just because of the technique from the procedure. We have to ensure that the pores are removed perpendicular from the skin. But other than that, there is a little bit of swelling, but a lot of patients say that they definitely look worse than they feel, which is always a great thing. In terms of social downtime, everyone is a little bit different. I would say about a week is a good gauge. I think that at about day 5, patients do really well with a tinted sunscreen. There is a little bit of swelling involved, and most patients, you'll notice it if it's your face and you're looking at yourself in the mirror, but other people don't really notice that swelling. I would say probably past that day 5, day 4 range. And we're always trying to find new ways to kind of treat the post-inflammatory or post-procedure redness that does happen. And one of the ways is through either a laser treatment targeting blood vessels, and then we also have a regimen to reduce any potential for pigmentation after the procedure as well. Today we'll be treating Dr. Behr with her second treatment of the Ellacor device, and this device is FDA approved to treat the lower face. So we'll be concentrating mostly on the cheeks and the upper lip today. What this device does is it removes several pores so that we can decrease the surface area of the skin and thus cause a lifting effect. So what does this treat? It helps with smile lines, it helps with a little bit of the jowling, any perioral lines as well. By decreasing that surface area, we can decrease the wrinkles around the mouth and also give an upper lip lift as well. Don't forget to check your phones. You'll be receiving a text for attending our event and respond yes for your free consultation. Also, don't forget to check your emails and your phones. We'll be contacting you via email or telephone call to let you know if you are a winner of our giveaway. And stick around for a live Q&A with myself and Dr. Behr to talk all things Elacor. Thank you for attending.
Oh, there we are. Hello, thank you all for joining us. Dr. Mathieu does a great job. She's done 2 of my treatments, and we're going to answer any questions. My treatment, my second treatment that we recorded was done just over 3 weeks ago, and really I was swollen for a couple days, but then I did go out to an event. Actually, that was on Monday. On Friday I probably was a little swollen, but with makeup I don't think most other people knew, but probably wouldn't suggest that for most people, but I do push the envelope a little bit. So this is really a great new treatment because we have so many treatments that build the base or build muscle or build volume, but we really need to shrink the tablecloth or shrink the skin. So I'm going to let Dr. Mathieu, let's see, do we just do questions now? So let's see, please send in your questions. Also remember, you'll be eligible to win the $1,000 gift card. And then for attending tonight, we do have some specials that we'll go over in just a little while. First question, does this treatment help your skin not to appear dry?
That's an excellent question. So in terms of what causes your skin to be dry, that's really maintaining the moisture barrier. So this is a little bit different from that, but after the procedure, we do recommend using petroleum jelly or Aquaphor to keep the skin lubricated, and it's really removing that surface area.
Yeah, it's really to remove and shrink the skin, so we really don't have too much else that shrinks, like I said, our skin, thinking of the tablecloth, and then underneath the fat and the bones are on top. How many treatments will I need?
That is the million-dollar question. So everyone is a little bit different. Typically, we recommend 2 treatments. Some patients will need 3 treatments to kind of get that full benefit, but each treatment, you will see an improvement, but we recommend at least 2. And we'll definitely give you a gauge of how much, how many treatments we think would be great for you during your consultation.
How long will a treatment take, and is it painful? So I can answer, it's not painful. You are completely numbed for that. So you do get a few injections or blocks to have the little area, and she does a great job with that. The treatment is very important to have somebody done, and Dr. Mathieu does a great job and make sure all the cores are removed, because you want that skin to help to shrink. Usually takes,
I would say, the actual treatment time takes about an hour to an hour and 15 minutes. It's usually the prep that takes a little bit of time, because we want to make sure that you are completely comfortable during the procedure. So that's the time that generally takes up most of the visit.
Are you able to do a test patch to make sure this will work for me? Unfortunately not. It is really, if you have the right, the skin type, it is going to shrink the skin a certain percentage. Like a lot of other procedures we do, there's different ranges of responses people have to that, but we know we can take out a certain percentage, anywhere from 5 to 8%. And then again, if you're going to do that 2 or 3 times, then you're really shrinking this area. This time I really noticed this tightening and it helping around the jowls and the smile line. So I think that's there. Here's a great question. Is the upper lip lift similar look to getting filler?
I would say it's more equivocal to actually having any type of neurotoxin injected to your upper lip, because it kind of gives it that lift, except this will be more pronounced because we're actually removing the skin. So it's not really contributing to plumpness, but it will give you height. So your lips will appear bigger because there's less surface area.
And the other reason that people really do it, that's a great point, is because as we age, the proportion of the length of the upper lip to the lower lip gets longer, and then the lip disappears. So sometimes people will actually have a surgery underneath to do a lip lift, and they're now doing about 3 treatments of the Elacor this to remove texture. So it gives, like she said, exactly a lift or more lift to the lip and narrows that distance. And again, you can do it, if you're doing 8% and then you're doing, 3 treatments, and that's 24% of that tissue that's being removed to help lift the lip. Is it very painful? So we already asked that. That's a big thing. So it has to be numb. So we do numb for this. It is little numbing shots. But then afterwards, really, it's not painful. So I guess that's a good thing to say, because some things, there's no heat. Like when we do laser, there's more heat. So sometimes you can feel heat for a while. With this, really, no, it's just more, you get a little tender where the shots were given, and then, you just look swollen, and, it just takes a little while for those holes to shrink up, but they're very, very small, so they don't give any scars. Is this a good for the area under the chin if you have crepey skin there?
So currently, this procedure is FDA approved to treat the lower face and the perioral region. In terms of the crepey skin, we do have alternative injections such as Radiesse or different devices that can help with tightening. We do, make sure that we pull the cheek up, so it does get a little bit of that submental margin here to actually help with the tightening. But there's difference between like certain levels of laxity versus excess skin and how that is portrayed. So it's really a multimodal approach to ensure that you're getting the results that you need.
So I think when you tighten this, and it, that's why we like to do this area, because even if you tighten a little bit along the skin, it all helps to lift underneath there. And I think, the first area that we're doing more and more is just underneath this area to help the crepey skin more on the lower neck. I probably would, like you said, look at Radiesse or the Morpheus or a combination of those treatments. Also, we do different things. So I think that, it's going to be used in broader and broader areas, but right now we're really using on the chin, the perioral area, and just starting to go underneath the chin in this area, not really down on the neck, but everything is evolving. So I think that's great. Perfect. Let's see. 15 or 54 new questions about it. Okay, that's fine. How do I get that up there, Nicole? Huh? Okay. There you go. Okay. Can you talk about the recovery time more? Oh, yes, definitely. So, like the first day you go home and actually you do have some bleeding. So, I mean, we do want a lot of bleeding. I mean, when we do PRP, you're kind of red in that. And then the second day, really, you just wash with cool water. I put Aquaphor on, but very little because I didn't want too much on. Compared to like CO2 when you really want a whole bunch on to layer the area. I was pretty swollen post-op day 1 and 2. But otherwise, I mean, unfortunately, if anybody came in, I came to work. I saw my patients. And then on day 3, really the swelling was going down. I knew I was still swollen, especially I was, more heavy because the swelling kind of settles in this area. But by day 4, I can put different types of cover up on because you're still red. And then, like I said, I had a gala that I went to on Friday. So Monday to Friday was that where I think with my makeup, it looked pretty good, but I still probably knew myself was a little bit swollen, but other people probably didn't pay as attention. We're our own worst critic with this. Let's see, can this be used on the neck? So like we said, we can use it usually under this area. We're expanding to more areas, but this skin right now, often we'll combine it. So we'll use, this to really help to lift. And by lifting the cheeks and lifting this area, you're helping the jowls and helping some of the loose skin on the neck, because that's why you do facelifts from in front of the ear, to help lift that area. And then we'll see as time goes on, we might go further and further down on the neck. But, we want to make sure we have good results. So we're going to kind of see, the different research that is done on the area. Would this eliminate need for fillers?
That's a great question. And this comes back to the point of kind of having a multimodal approach. So as Dr. Behr referenced in terms of the table and the tablecloth, if you think about your bone structure and your subcutaneous tissue as the table, you still need the table in order for the tablecloth to be draped over it. So the filler acts as the structural component, and the microcoring procedure is more so decreasing the amount of fabric in the tablecloth.
And so, as time goes on more and more, and we go to all these meetings, the best treatments are often combination treatments where, like she's saying, you're treating that. Now, everybody ages slightly different. So some people need more volume. Some people have the volume and just have the surface. So that's really where a consult and with that. With this, how much treatment do we recommend how much time between the treatments?
We say at least 4 weeks, and that's not a definitive time. Sometimes if scheduling happens, life happens, you'll still have compounded results, but kind of that 4 to 6 weeks is a sweet spot of when your collagen is producing, and to kind of give it a second hit to increase your results.
Took me a lot longer, of course, the time period, but like I said, you're still taking that skin out and you're still getting that contraction of that area. Can you do this on the neck or other parts of the body? Well, people are working on that. We do are doing it, starting to do it for stria or stretch marks, or for other like cutting scars. And so you can help because you're eliminating those areas on that. When I did my first treatment, I did a test spot, of course, because it was me under my arm, one on my abdomen, one on my leg. The abdomen and the leg healed really pretty quickly. The one under my arm was pigmented. So we're working on that. But like I said, we have different things and different areas might work, and we have to get a certain tenseness of the skin to get the pores to be removed. With that, the treatment for this, usually because it's 2 or 3 treatments that we usually give a package. So with 2 treatments, it's $5,000 for the series of 2. Usually one treatment is $3,000. We are offering, some healing skincare and some Botox specials with you attending tonight. But it's a great procedure that nothing else with really downtime, but very short downtime compared to like the CO2 laser, which I've also had. How many treatments are suggested?
2 to 3.
2 to 3, and so far that's what, we're seeing, and you get continued. I mean, like I can notice like this area is tighter, but it will continue to improve, I would say, over a few months because it takes that while for the collagen stimulation to occur. Great questions. How does it compare to Morpheus 8? Great question.
So again, with the Morpheus 8, which is a radiofrequency microneedling device where we're delivering radio frequency energy to stimulate denature and to stimulate collagenesis. This procedure is specifically removing a cylinder of skin to decrease surface area. So with the radio frequency microneedling devices, that does help with tightening because you're stimulating collagen, but this is actually decreasing surface area.
Yeah, so this is decreasing more surface area. The Morpheus 8 is great because on the body we can go deeper, and often we'll combine it with different areas on that. Is this done with just facial numbing? Usually, I mean, we can give people, an Ativan if they have a driver or a shot of Demerol. I just had the facial numbing. I was fine with that. But we want to make everybody has their different pain tolerance, so we want to make people comfortable. But really, yeah, there's really no general anesthesia with this. And it really, because the area is numb, and if you feel anything, then we stop and put more numbing in. This is a great question. So is this just for lighter wrinkles, not extreme lines? So that's a great question. But I think, if we're looking, because we still do a lot of CO2 laser, which if you have what we call solar elastosis or thickening of the skin, sometimes we need, before we take pieces of the skin out, we need to get rid of some of that solar elastosis. But sometimes people have pretty deep but just smile lines, but their skin is pretty thin and they don't have that solar elastosis, and then I think it works great for that. Yes. So I think it can be pretty extreme smile lines, but as long as the area is not thickened. But we usually see that more around the lip, that we get like this yellowish color or the thickening, and that some of that needs to be removed with that. So let's see, does this require upkeep long term?
So as with all procedures, we always tell our patients, no matter what intervention you partake in, we're still aging, and there's still processes occurring that we're kind of working against, essentially. So this is kind of taking out the skin in the picture format, and it's not like the skin is going to regenerate, but gravity and age and changes that occur with our skin biologically is still going to occur. But it's not something that you have to feel like you need to upkeep. It's kind of like a snapshot, similar to if patients get CO2, they might get another CO2 in 4 years. So they don't really have to upkeep or maintenance anything for a yearly basis. But when you reach a point where you might want to do it again, it might be a few years down the line.
Yes, I agree. So, it's not like Botox there, but it's, unfortunately, even when you have a facelift, you start and turn the clunk back, and then you kind of age from that point. It doesn't go back to normal like Botox, or when the filler's gone, that skin is always going to be gone, and then you're just going to age from that point. Keloid scarring, would it be okay? That's a good question.
That's a great question. I would be a little bit hesitant to perform this procedure because, there's so much that's unknown about keloid scarring and the origin and the pathophysiology. So we would probably avoid this procedure in patients who have a tendency to develop keloids.
Yeah, but there is a difference between hypertrophic scars and keloids, and people often get them confused. So keloid is actually a scar that grows much bigger than the original injury, whereas a hypertrophic scar is when you get an excision or cut, it gets thicker, but that it would probably not be a contraindication. Any contraindications for those with acne-prone skin?
No contraindications for acne-prone skin. We monitor you very closely after the procedure, and sometimes patients may break out, as with any procedure. That's not really on the acne pathway, and we can prescribe oral antibiotics or anything that's needed if you do have an outbreak, but that is not a contraindication to the procedure.
Yes. Yeah, a lot of the times, if we're doing something to improve that area, we really want to treat the acne first, either with medicines. We also have a laser that helps to do that with that area there. Aquaphor is thick, but it melts pretty good. And I put a very thin layer and really didn't put too much. I think, this really is, how does it compare to Morpheus? We kind of answered that. It does more tightening. The Morpheus uses radio frequency and heat to help at different levels of the skin to maybe stimulate the collagen at different levels, but this is actually like shrinking the tablecloth.
And I think that comparison is great to reference the question previously that was asked regarding the deeper, larger wrinkling. I think that the Morpheus 8 or radio frequency kind of helps with the fine wrinkles, but those deep, heavy wrinkles, I think this has more of an impact.
It has more of an impact for those areas. That's a great idea. Can this be done in the eye area?
We do not do this in the eye area.
But we are thinking and doing different combination, because we do Morpheus 8 fairly close. I mean, as long as we can pull it orbital rim. We also both do CO2 laser with eye shields, and I think that's a great area, especially because the eyelid skin is much different than the cheek skin. So it's so thin that with the CO2 laser, you get more contraction in that area. And with the aggressive treatment that we give around the eyes, you can get similar to almost a little bit of a bluff if you're doing it correctly. Let's see. Can we still do it if we have Sculptra Air Filler in the area? Obviously, I've had all of those things, so yes, you can. Sculptra, is something that the filler goes away and you produce your own collagen. With filler, you can, and there's no contraindications with that.
We're just mindful of the timing of the procedure.
Yes, mindful of the timing. Only the lower face can be treated. My forehead appears lax from this Mohs surgery and would love to have that tightened. So the forehead, we do have 4 other things. So you can use the Morpheus, you can use the Ultherapy on the forehead. Also, sometimes if you have concavities, you can do filler on the forehead. We also have M-Face, which is really non-invasive to help lift and tighten the forehead by tightening. So the M-Face helps tighten the levator muscles. So again, all these are different combinations that we do with that. I have a stubborn quarter-sized brown spot that I haven't had much luck with getting that diminished. Would this help with that? I don't think that's the right treatment for that.
No. But if you come in for a consultation, we can kind of cater a treatment plan.
And if something's resistant, especially a brown spot, then it needs to be biopsied and just needs to make sure it's not evolving from a lentigo into a lentigo maligna or a melanoma. But this is really to help tighten the skin. We do have Fraxels and other lasers and CO2, which is much better for pigments. Again, let's see. So the cheeks and around the mouth, the upper lips. Will antibiotics be necessary? There's a great question.
So for this treatment, we do not pre-treat with antibiotics. And as I said previously, we monitor you closely if any changes or concerns occur. But it is not a high risk of infection. As with any form of trauma, any break in the skin, any treatment, there's always a risk of infection. But the risk is low, and we do not pre-treat with antibiotics.
Yes. So I agree. I didn't treat with antibiotics. I had no issues. I do get cold sores, so we do treat for that, because especially if you're going around the mouth close to the lips, and that's where you get fever blisters, those come out with trauma. So, that can be. Microneedling was hard on my skin due to massive bruising. Would this be the same? I think you could, if your skin is that thin, get bruising. Often, even from the numbing shots, you can get bruising. But then, fortunately, we do have some different lasers to help with that. But I know with some people, it can be quite significant. Is there discomfort after the initial numbing wears off? No, not really. Like I said, this has no heat. So it's amazing really how you just feel swollen, and it's like almost like, if after, even when you take a shower the next day, it didn't hurt or sting. I use like a gentle soap with that, but really no pain, no pain. And it's not even as bad as if you fall and abrade your knee, because the whole area, it's very selectively, you're only taking a percentage of that area out. What is there a maximum number of treatments that an individual may have? I don't think that's quite known yet. No. That's a great question. Yes. But right now we're usually doing 3 treatments, but I'm sure that people will push the envelope on that. And since they are doing biopsies when they studied this and studying the skin later, and they didn't see any signs of scarring afterwards, because the areas are so small, then you don't have to worry about that. Can this be done in conjunction with buccal fat removal? I mean, you probably wouldn't want to do it on the same day. Often we do use Kybella, for the buccal, or you don't really want to remove too much buccal fat, often the gel fat, and you can gently shape that. And we can do that with Kybella. We can do that with liposuction. Yes. Was Dr. Behr's lip, jowl, and cheek one area? Yeah, you treat the whole area. And like I said, we're also going down on the jaw, and probably soon we'll be including, it just depends, underneath the chin. But then often we'll probably do it in combination with other areas. But yes, that's that there. We already went over different from micro needling, because you're removing actual tissue. You're actually removing a percentage of the skin, which is the only other way you can do that is facelift surgery. So by cutting and doing that, you're actually removing a percentage of the skin. I had a lower facelift 5 months ago. I would love to consult Dr. Behr, because recently it was advised Morpheus 8 and filler for mouth areas still needs volume. I think, that's a great thing. Probably would wait 6 months, but I'd love to have you come in and have a consult, and we could see what would be exactly the right thing for you. Like I said, around the mouth, if it's just deep lines, but there's not a lot of thickened tissue, you can do them, the microcoring. If it's thicker, sometimes we do the CO2, or if you want, lower on the neck, you can do the Morpheus 8. Often all of those can be combined with filler to give a more natural look, and that. Okay, perfect. You're going to be getting a text message and reply with the word Behr to be contracted for a consultation. So please just reply with that, and we'd be glad to see you and have a consult and see, we have so many great options, and, our job is really now all about education, because we have so many things, and, we want to make sure each person is unique and each person needs to be treated differently. I am 35 with heavy cheeks drooping down. Am I a good candidate for this treatment? And then also, is it good for mild Marianite lines? So I'd say yes to both of those treatments. But again, if the cheeks are drooping, we'd want to see, is the cheeks drooping because you have, excess skin, or because you have excess skin and you've lost volume and you need, like M-face to build the muscle volume up, or filler with that. It definitely does help texture, like the CO2. It's not the downtime. I've also had the CO2, but it is actually removing more skin, more there. So again, it's giving more lift in the jowl area and the marionette area. This is a great question. Can this be done for acne scarring? So we were just at the meeting, because we're always learning, and the first time we thought we were doing this, and now there are people that are doing it for acne scarring. I'd say, also Morpheus 8 is good for acne scarring. It just depends how thick the skin is, because sometimes you have to make sure you're getting the pores out adequately. So we'd have to evaluate each patient on the individual thing. Where was this treatment originated, and how long has it been in practice? Great great question. So this was at Harvard. They worked on this for several years. Some of the great laser minds that created a lot of the different lasers. And I'd say, you know, it's been out probably about 9 or 18, you know, probably, you know, 18 months, but now we've been doing it since October. Does it work on men? Yeah, my husband had it the same day I had it. We had it on our anniversary for our first treatment. Yes, definitely can work on men. It'd probably be easier if they did have beard hair that they shaved, because it would be difficult to get the cores to adequately come out. It would not, because there's no heat, destroy the hair. It might punch out a very few amount of hairs, but not enough to cause any baldness or any difficulty with that. Since there is a bit of bleeding, how will it affect someone on Eliquis? So Eliquis is a blood thinner, and you know, you're going to bleed a little bit more. We do give lidocaine that has epinephrine in it, you know, different people bleed at different amounts. It's really a very tiny hole, so it's not contraindicated, but you would have, that's a great question, more bleeding with that we control with, you know, I use a bunch of ice and just compression, and it did great. If you have had filler, how long should I wait to have this done? Great question.
So I think that also depends on the type of filler and what level the filler was placed. But typically, you know, I think 3 to 6 months is a good gauge depending on where the filler is placed. If it's very superficial, we don't want to remove the filler, so we want it to integrate into the tissue a little bit more. But if it's a deep filler, then that's a little less time.
Yes. Here's a great question. Does this stimulate collagen production as well as contracting the skin? Yes, definitely, because you're making those holes all the way down to the fat. So you're taking a complete core of the skin out. So as that's healing, anything we do really is waking up those fibroblasts that, as unfortunately after you turn 20, kind of slow down in that. So by any trauma or injury, then, you know, you really, you know, get, improvement or activation of those fibroblasts. And that's a great time to say, so after this procedure, you know, we're using exosomes, which are great treatments to help stimulate the fibroblasts and stimulate the healing. So with one treatment, for listening to this, we're going to give you your exosome product. If you buy 2 treatments, you're going to get some Botox in the exosome product. And if you do 3 treatments pre-purchase, then you're going to get 50 units of Botox in the exosome treatment. Let's see, doesn't harm fillers. Let's see, how long will it last? Let's see, upper eyelids. We don't do it on the eyelids. We use the CO2 laser with that. If you want to lift the eyelids, we use M-Face, and also we can use Ultherapy or filler or threads. Are you medicated? You can be medicated if you would like to be. If you are medicated, you have to have a driver. I wasn't medicated, so I could drive because you just have lidocaine. We can do this over the beard area, but you would have to be cleanly shaven for it to be, so the needles would penetrate and take away this. Would it be beneficial to alternate between Elacor and Morpheus 8? Well, that's interesting, because so I did my Elacor, and then I didn't have enough time for another Elacor, so I did a Morpheus 8 or Dr. Mathieu. So you definitely, like I said, combination treatments, and then you can do the Elacor around the eyes, the forehead, or on the neck, or sometimes we could do the microcoring on the face and then the Elacor. But it is something we love to alternate and combine different treatments to do that. Let's see. So CO2 uses laser, which it's chromophore, that the CO2 is looking at water. So it's actually making controlled burns to the skin. We do a CO2 laser that's both what we call deep and superficial. So the deep makes tiny holes to stimulate collagen, the superficial to wipe away that thickened skin. But it really doesn't take out volume of skin. Here's a great question. During recovery, are you to avoid direct sunlight?
Yes.
Yes, for most patients, with that, you can. With that, you have to always avoid that when you're healing. Otherwise, you're at much higher risk of, hyperpigmentation and not healing as well. I was a smoker for many years and obviously have deeper lines around my mouth. Suggestion. Microcoring. I mean, I think it would do great, but like I said, sometimes it's in combination. Depends how thick the skin. If it's just deep wrinkles, sebaceous hyperplasia, those are usually individual lesions, so you're going to have a hard time. It will probably help with that just by having the areas there. How does it remove skin? So how does it remove skin is the microcoring has these tiny needles that takes out actual cores of skin down to the fat, but those cores are so small that the area heals without scarring. They've done biopsies and histological tests on that.
So it's almost like a cookie cutter being placed down, and that's attached to a suction tubing, and that suction tubing removes the cores after the cookie cutter forms the cylinder. Yeah.
So cookie cutter, but they're so small you don't. How long do we have to use the 3 treatments if we purchase the package? Is there a time frame? No, we haven't really, I mean, I think you'd probably want to try to do it within the year, but, we don't really have a time frame, it's a great procedure. We're going to, we're not putting a time frame on it. We just want to give each person the best result, and we know things happen. So I think that you guys have done great with the questions. We're always here, and if you would like a consult, please type in Behr for that, and you can answer more questions. And we're doing great with this procedure. Dr. Mathieu is expert and is lecturing on this to different physicians. And, thank you for attending. And we just have so many options that this is a great option to help, certain people who have those smiled lines with thin skin and a little lifting of the jowls and the marionette and the nasolabial folds, because it's actually removing that skin. So anything else that we need to do? So we just want to let you know that we appreciate you all for attending. You had some great questions, and have a good night.
Thank you for joining.